everybody. What is going on? I should say happy Tuesday. At the time of recording this, it is Tuesday, April 6th, 2021. And let's face it, we have been in the whole mix of the pandemic for more than a year. And that means a year of screen time, right? So being dialed into all of those Zoom calls, virtual learning for kiddos, and just plenty of, I guess, virtual get-togethers, right, with families over the holidays and then some. So we wanted to dive in and tackle some topics that are all about your peepers, right? Improving your eye health, but tackling things as well on how to curb dry eye symptoms. How many eye drops is too many eye drops to be putting in a day until maybe you should see a professional? We're going to be diving into all of that. And if you're wondering, who's going to help us field all of these questions? From Geisinger, the one and only Dr. Stacy Conway. She's with us. She is an optometrist and the director of optometry, Geisinger Northeast. How's it going?
Good, Ryan. How are you?
I'm really good. So listen, you are all things eyeballs, right?
Correct. Yes.
How long have you been an optometrist, and describe sort of your background, maybe what you specialized in, and then we're going to start hitting some of those questions about digital eye strain.
Sure. So I graduated from optometry school in 2003. I've been with Geisinger here for about 10 years. Optometrists are one type of eye doctor that treats many different conditions, glaucoma. We monitor for diabetic retinopathy, macular degeneration, but we also prescribe glasses. That's really one of the main things we do: contact lenses, glasses, see pediatric populations right up through adults.
And describe the difference between an optometrist and an ophthalmologist.
So the main difference is ophthalmologists tend to do some sort of surgery. There's different specialists they could be a retina specialist, a glaucoma specialist, a general ophthalmologist, but most of them do surgery. Optometrists don't do any surgery. We treat the same diseases, but just in a different way.
And as we continue, by the way, throughout this interview with Dr. Stacy Conway, the director of optometry with Geisinger Northeast, feel free to drop us any questions you have related to digital eye strain, tired eyes, dry eyes. We'll hopefully be fielding some questions at some point, but let's get right into it. So here we are, just over a year into the pandemic, where everything in everybody's world went virtual. So tell me, what is digital eye strain? How is it sort of defined? And what have you noticed because of everything in the virtual age?
Yeah, you're right. Everybody's world was kind of flipped on end. So I see patients from, as young as 2 to 3 years old up into, an adult. So everybody had a little bit of a different issue. So some kids went from going to school every day to, fully virtual schooling. Adults went from going into an office setting to working from home on a computer all day. And some other adults that went to continue to go to work, in their primary setting, are now required to wear masks the whole time. So all those things can make your eyes, they have a little bit more of an issue depending on what they're doing. So digital eye strain is a group of symptoms that result from people that are on the computer way more than they used to be, and probably way more than they should. So it depends on the situation, but there can be a lot of different symptoms.
And we're going to dive in a little bit deeper. We're going to pull back the curtain on those symptoms and the red flags that when you need to see a specialist. But I guess just talk about what you've noticed as far as maybe patients' upticks in certain types of eye issues during and as we slowly start seeing the light at the end of the tunnel with more people getting vaccinated. What have you noticed when it comes to people's eye health?
Yeah, I guess the biggest complaint that we're getting from patients, especially adults, is just dry eye. They're not comfortable. By midday to the evening, their eyes are burning and tearing, and they're not maybe seeing as well as they were starting off in the morning. Kids don't tend to have those symptoms just because they have a little bit better tear production. But that's been the biggest complaint coming into the clinic. Just by the end of the day or by the end of their work shift, their eyes are tired and fatigued.
And describe, when it comes to digital eye strain, let's peel back the curtain even more and talk about the symptoms, right? And are they different for different ages?
Yeah, they're totally different for different ages. I mean, children tend to not have too many vocal symptoms. Parents might notice that they're avoiding to doing prolonged work at the computer. Adults tend to be a little bit more vocal, where they have that fatigue, blurred vision, tearing, burning red eyes, or headaches. And that's another one. People are coming in with headache complaints more frequently now too.
And with so many people obviously dealing with dry and tired eyes, before you have to go see a specialist or make that call to an optometrist or ophthalmologist, what do you recommend folks to attempt first? Is it blue light glasses? Is it eye drops?
Yeah, so I guess it depends on the symptoms. So I do a lot of pediatrics here, and the moms and dads are very concerned about their kids spending too much time on the screen. So I always try to tell them that it's, the academic or the educational screen time is what it is. They have to do that. They can't, fall behind in their schoolwork. So I always try to have the parents try to limit the screen time for the children for extracurricular activities, just for fun and things. So I'll say the same thing for an adult. Try to go to work all day, do your if you're online, do your online work. But once your shift is over and your work is done, it's a great time to just stop what you're doing, take a break, get outside, get some natural light, and that will make you feel a little bit better. If they're still struggling after they've been taking some more breaks, I'll start to say to start with like an over-the-counter lubrication drop. That tends to help relieve some symptoms. You can buy them anywhere. They're in any pharmacy. They're not medicated, so you don't have to worry about overusing them or them interfering with any other medications, even other eye drops that you may take. There's preservative-free types of over-the-counter drops, and there's preservative in some of them too. But ultimately, just get them in your eyes, ideally a couple times a day at least, and then maybe right before you go to bed.
And just, I guess, when it comes to eye drops, do blue light blocking glasses, is that the first step before you get to the eye drop section?
Yeah, it's funny because that's all the buzz. Blue light glasses, I probably hear that 5 or 6 times a day. Technically, there's no scientific proof or any scientific studies that have shown that a blue light glasses provide any relief from any computer symptoms. Now, that being said, I have patients that will come in and swear by them and say that they really help them. And anecdotally, that's fine. They can definitely use a set of blue light glasses. But really, I think the bigger thing would be just to take frequent breaks. There's something called the 20-20-20 rule that is kind of popular, where about every 20 minutes you should stop what you're doing and try to look either out a window or down a hallway and count to 20. So that's the 20 seconds, and try to stare 20 feet away. So that really helps. It just relaxes your muscles, and it allows those eyes to take a break and focus on a different distance. But again, the blue light glasses, they don't hurt anything, but most people don't really notice any problem, with needing to wear them all the time.
At one point, so if you maybe try blue light blocking glasses, and I know you said it's sort of to each his own, right? If it's going to work or help, and then you've attempted eye drops, what are the red flags you need to look out for when you need to maybe pick up the phone and call an optometrist or ophthalmologist? Like, what's that crossover point?
Yeah, so I mean, in a perfect world, everybody's getting a routine eye exam every few years. If you wear glasses, you should really be coming once a year to get your eyes checked anyway. But if you're trying, any type of lubrication drops and you're fatigued, or if you're getting, significant headaches, I think that's probably the time where it's time to kind of call the doctor, just to make sure that there's nothing else that we need to do. Another thing to mention is sometimes there's a real slight prescription, especially something called astigmatism, where you could have that type of prescription and not really be aware of it. But when you get the computer for prolonged periods of time, it can definitely start fatiguing you, where a pair of glasses, prescription glasses would make a difference.
And what have you noticed, I guess, specifically with your patients and your own personal experience? Were you treating more adults for digital eye strain or more troubled kids with eye issues?
So I feel like I treat more symptomatic adults. They'll come in and tell me that their eyes are bothering them, or they're fatigued, or by the end of their work shift, they're tired. I see a lot of kids, their parents are the ones that are really most concerned about that. I'll get them the questions from the parents. Can we do anything differently with regard to online schooling and the blue light glasses and things? So I think my practice in itself hasn't changed too dramatically as far as who I'm seeing, but the complaints that I'm getting from them, or just mainly the concerns from parents especially, that's probably what's most different.
And with so many work environments, maybe keeping employees out of the building and still more virtual through July, some aren't going back to September. Do you expect to see an uptick, or do you think kind of things have leveled out as far as any eye issues from spending so much time in front of screens?
I mean, I feel like the eye strain part of things isn't cumulative, where, the longer you're doing it, months and months and months, it doesn't become more fatiguing. I feel like people that were going to have the strain probably would have had it already. Remember, a lot of it's from dry eye. So I would argue that the winter months will probably a little bit more strenuous on the system, because that's when patients tend to have a lot of dry eye complaints anyway. If they're sitting in front of a heater or the air is drier in their environment, they're going to have a little bit more fatigue. Also, don't forget, when you're on a computer, forget about pandemic or not, you're concentrating, you're not blinking as much. So if you have a borderline dry eye issue, just sitting at a computer for any length of time is going to make your symptoms a little bit worse to begin with. So I'm hoping as things start opening up that things will get better. I might argue that the complaints might be a little bit differently. So we're going to open up and be masked. And there's a whole other slew of things that sometimes those masks will cause dry eye symptoms. If you have a very ill-fitting mask, if it's not, pinched on your nose and you're getting the air coming up as you exhale, coming into contact with the front of your eye, that's going to dry your eyes out a little bit more also.
How do you tell the difference between digital eye strain versus just dry eyes? Is there a big noticeable difference, or do they?
No, not really. I might argue that, digital eye strain, a dry eye is just one component of the digital eye strain complaint.
Okay. And now, of course, the big question, when I told people I was going to be talking to you, and they're like, yeah, I get dry eyes, but sometimes I put in eye drops. How much is too much to be putting in a day? Because then I know there's prescriptions that are like once a day, and then it feels like you got hair gel in your eyes because they're so thick.
Right.
So how do you kind of gauge how often you're actually putting eye drops in to lubricate your eyes and treat some of the dry eye / digital eye strain symptoms?
That's a great question. So if you're using a true lubrication drop, an artificial tear, we always say to start maybe 3 to 4 times a day, just to see if that alleviates the symptoms. It's tedious to keep putting a drop in. So the less you can put it in and be comfortable, the better. But there's no medication in those. What I would suggest to avoid would be anything like a Visine or a Clear Eyes that would say gets the red out. Because if there's some component that's going to get the red out of your eyes, they're a medicated drop, and you really shouldn't use those at all. You should, just use a lubrication drop. If you're putting those in, very frequently, 4 to 6 times a day, that might be the time where you come in to see me or one of my colleagues, because there are prescription drops that you can take. You probably see them if you watch any television. There's a lot of commercials for them that are a prescription dose once or twice a day. That would be something you'd get from your eye care professional.
And Dr. Conway, if left untreated, what happens to dry eyes or just digital eye strain? If you're noticing there's an issue and your eyes do feel dry, but you're like, I don't need drops, I'm good. Does this kind of keep rolling like a snowball, and then it gets bigger and the problem gets worse? What does this lead to if you don't treat it?
Yeah, it's just comfort issues. That's basically the problem. So there's been people that have, their work productivity is decreased because they're at the computer a little bit less. They might avoid prolonged close work. It's not a cumulative where it could cause any significant disease. Sometimes if it's severe dry, you can break down the front part of your eye called your cornea, or you could, be more prone to infection, or you can have other things happen. But that's a rarity. And usually people are very uncomfortable by that point where they're coming in to see one of us.
Right. Now, we've obviously talked about, what people are dealing with during the pandemic with more virtual learning and more time in front of screens. And dry eyes is a symptom that some people are dealing with. But have you noticed any upside to any of this? I mean, are people paying more attention to their eye health because now they maybe have more time to get in to see a doctor? If they're working from home, they can sneak out. I mean, I'm just curious.
Yeah, no, that's a great question. Yeah, for sure. I mean, I think people are anxious to kind of get back out and start living a little bit. So we're busy here. We're seeing patients. They have a little bit more flexibility with their schedules when they're working from home. I've noticed most of my patients either love it or hate it, speaking from the adult standpoint, because of that flexibility. So yeah, there are definite upsides to it. I feel like most of my patients that are working from home are probably being more productive because they don't have that interruption from other people coming in to kind of chat them up during the day. The downside to that is they're on the computer and not taking their breaks. A normal work day has its unplanned breaks. Someone comes into my office, we chit chat for 10, 15 minutes. I'm looking across the room at them versus just sitting at my computer staring the whole day. We have those planned breaks. We're at home. If you don't have those people coming in, you might end up being on there quite a bit longer than you would have otherwise.
Right. We're going to recap some of the big points in a moment, but if anybody has comments, we might fly a few in as they come to our Facebook page. I guess just a few final thoughts. Coming back to what you said about eye health in general, how often should you get your eyes examined, and why is that so important? Because I think people realize that if you go see an optometrist or an ophthalmologist, it's a lot more than just, oh, you might need glasses. I mean, you guys can detect I've heard stories, brain tumors by eye exams.
Sure. So, I mean, when you're coming in for your exam, of course, a lot of people are here just to get, their glasses changed or their contact lens prescriptions refilled. But I always tell patients there's two parts to an exam, your vision and then your ocular health. So it's a really good thing to come in. If you have glasses or if it's, a child that we're monitoring for certain diseases, we'll see them sometimes more than once a year. But ideally, a rule of thumb is every year or every 2 years is a really good idea to come in and get your eyes checked. Once you're over 40 or 50, that's where we start paying a little bit more attention to certain ocular diseases like glaucoma or macular degeneration that can be happening. And a lot of times you would notice a vision change, but sometimes you don't, where we're the ones that are diagnosing things that you would have otherwise not known about unless you came in for an appointment.
And that was basically the sort of driving home factors regarding appointments. But just recap if you can. If you're experiencing this, and this, it could be digital eye strain versus dry eye and things to try in case people jumped on it late.
Yeah, sure. So basically, if you're experiencing blurred vision or red eyes, burning, tearing, things kind of coming in and out of focus, those are all symptoms of digital eye strain. So what you'd want to do is you'd want to start with lubrication drops. You can put a few of those in a day. They're not medicated. Make sure you're taking your frequent breaks about every half hour. Stop what you're doing, look out a window, count to 20. And then if none of those things are working, then schedule an appointment with your eye care provider. If you have any of those symptoms that aren't getting better with the treatments, that's the main take home is get your eyes checked. During an exam, I would give you all these recommendations and I can kind of tailor make your specific plan to your specific symptoms.
And speaking of virtual age and technology in general, what has changed with eye exams that if people haven't been to see an optometrist or ophthalmologist in years and they're like, oh, I don't want to come, they have to dilate my eyes and then I can't see, like anything different in that capacity?
Yeah. So a lot of this things we've been doing for ages and ages and ages. So there's certain things, reading the chart, albeit the charts might be a little bit more digitalized and or checking with what we call a 4-opter or those big glasses that everybody associates with getting their eyes checked. I think that the greatest thing now and more recently is the imaging and the technology that we can do with regard to checking for ocular diseases. So really checking for glasses and contact lenses, that's not much different than it always has been. And there's quite a bit of art to that, and that's not all just science, but the machinery and the technology and the things where we can monitor for glaucoma, for retinal diseases and things like that. That's, I think, the exciting part of eye care right now. There's certain things even that I, when I got out of school 17 years ago, didn't exist, and I would never think we'd be able to see certain diseases of the eye that we can detect things a lot sooner now than we could have, even a decade ago.
And springboarding off of what you said with technology, have you or your colleagues ever had somebody in who's like, hey, I'm here for a regular eye exam, and then you caught something they had no idea was going on?
Sure, that happens.
Kind of reiterating the importance of getting an exam.
Absolutely. Yeah, that happens actually very, very frequently. Or they may know something is wrong. It happens almost on a daily basis where someone comes into the clinic thinking that they're just going to need a new pair of glasses, or they have dry eye, where we're diagnosing things. Unfortunately, they're much more severe, and it was just luck that they came in for that. So it's a really good idea to get routine care, because things can be detected that you wouldn't even know were happening.
And I was just going to ask you, I had one other question written down. What types of issues could happen if you are spending too much screen time? So say, as you mentioned, kids are learning virtually, but then they're back on it gaming. Like, what prolonged exposure, what does research show that this could all lead to?
Yeah, I mean, I think the biggest thing is just fatigue, and the concern is always from an education standpoint. So, eye strain or eye digital time is cumulative. So if you're going to sit on the computer for 6 to 8 hours on school, and then the minute school is over, you pick up your gaming system or your phone, and you're texting your friends. There's just fatigue. So there's no real disease process that it's going to, cause any concern, or you're going to need glasses because of that. But I think just from an educational standpoint, the fatigue is there, and kids tend to not do their educational computer time versus their fun time. So that's my biggest concern.
So much great information, Dr. Stacy Conway, the Director of Optometry at Geisinger Northeast. Any final thoughts, or something that I did not ask you that you feel is really relevant to the whole digital eye strain, dry eye topic?
No, I think just the biggest thing is just take breaks, try to give your eyes some rest, and get outside. The weather's getting nicer now, and just getting some sunlight and some good relaxation time of those fatigued eye muscles is really a good thing. And come in for your annual exams. That's important too.
And just so I don't miss it, give me the 20/20 rule one more time.
All right, 20/20/20. Every 20 minutes, you stop what you're doing, look 20 feet away, and count to 20. So 20 seconds worth of relaxing your focusing muscles.
All right. Thank you so much. And others for watching this. We really appreciate it. Dr. Stacy Conway, appreciate your time.
Great. Thanks, Ryan.